Dr. Hafsa Luttah. I work with Kakamega Dental Suites. I'm partnering with Ponea Health today to talk about sensitive teeth. Sensitive teeth is a painful condition which happens when the inner layer of the teeth, which we call dentine, is exposed in the mouth. So the exposure of this dentine could happen from a number of things. So number one, it could be from hard brushing, or if not hard brushing, use of a very coarse toothbrush. This wears off the tooth surface and it wears off the outer surface of the teeth, leaving the inner layer exposed and therefore more susceptible to the stimuli. Another thing could be from receding gums. This is whereby your gums grow back and they leave the root of the tooth exposed and therefore exposing your dentine. So the protective layer of gum is no longer there. Therefore, this tooth is exposed to all the stimuli in the mouth. By stimuli here, we are talking of either the hot foods or the cold beverages you take, or sugar, salt, things like that. So the gum is receded, the tooth is exposed to the mouth. Another thing could happen is erosion by acids. This could be, a common example is, let's say in pregnant women, due to morning sickness, this kind of vomiting will erode the outer lining of the teeth and therefore expose the inner linings to the stimuli in the mouth. Another cause could be a crack on the tooth. These cracks can happen from either chewing hard foods, opening a bottle of soda with your teeth, and the tooth gets a crack and it opens a leeway for these foods to be in direct contact with your inner lining of your teeth, therefore brings about the sensitivity. The exposure of the inner lining of the teeth could also happen from individuals who have tooth grinding habits. This wears off the enamel, which is the protective layer, and it leaves the dentine exposed to the stimuli in the mouth. So all the teeth can be affected, but there are now teeth which have a higher probability of getting this. So for starters, it could be for people who have, let me call them weak teeth in quotes. These are teeth that when they were developing, they didn't get to mineralize properly. So they have what we call hypomineralized enamel. It makes them a bit porous and therefore more susceptible to this stimulation by either heat. So the teeth that commonly experience sensitivity, for one, these are teeth that have been compromised during development. They end up with what we call hypomineralized enamel. It makes them more porous and therefore the inner layer of the tooth is more exposed to the stimulus. Another thing could be if your teeth have a lot of cavities. This also allows the protective layer which was covering the inner tooth has been removed by the dental cavity. Therefore, the inner bit of the tooth is exposed. You'll also experience sensitivity. People with grinding of the teeth, they've worn out the surface of the tooth. Therefore, this type of teeth, high chances to experience sensitivity. Another case is whereby you've undergone certain types of procedures at the dental clinic and while at home, you experience sensitivity. The common one is bleaching. After a bleaching procedure, the dentist will prescribe to you a fluoridated toothpaste to use at home. This will help ease this symptom. Another procedure that could end up giving sensitivity is the routine fillings we do. There are some of the materials that we use. A patient could end up with sensitivity from a few days after the procedure or maybe a few years after the procedure. You get sensitivity depending on the material that was used during the treatment. Thank you for joining our discussion today. You can book our services at ponea.com. I'm looking forward to engaging with you in the next episode.